Hey y'all, it's Kylie. I'm doing my presentation over concussions. Concussions have recently made it to the front of the news on injuries and their long-term effects. In the U.S., there are approximately 50,000 deaths each year due to concussions, and 900, or 1.8% of them, were sustained during sports and other recreational activity. A concussion is caused by the shifting of the brain inside the skull, leading to bruising on the brain. The areas of the brain causing the common symptoms are the mesencephalon, corpus callosum, and fornix. Trauma from impact causes axonal changes and alterations in dopaminergic signaling, leading to the symptoms of a concussion. Working memory is affected by those alterations in dopamine signaling, interfering with one's memory. The presentation of a concussion is dependent on the impact and severity of brain trauma, and still, each may present differently. If a patient is symptomatic, some symptoms may appear at the time of injury, while others may not appear until a later time. While symptoms may vary from person to person, the most common ones are loss of consciousness, memory loss, headache, dizziness, and emotional lability. As severity of trauma increases, so does the potential for long-term effects. Many different techniques are used to diagnose concussions, such as the standard assessment of concussions, immediate post-concussion assessment and cognitive testing, forms of Romberg testing, and a symptom checklist are the most common used. Oftentimes, imaging studies won't be done on a person's initial concussion unless more serious causes, such as a head bleed, are suspected or unless symptoms are long-lasting. A CT or MRI are the preferred initial imaging modalities. An MRI is preferred for those experiencing prolonged symptoms. This picture shows a CT that represents a change in activity in the brain after a concussion, but CT scans are often normal, while MRI might pick up abnormalities missed on a CT. Axonal injury and brain contusion found on imaging are often associated with the patient later experiencing post-concussion syndrome. Treatment primarily consists of physical rest, but also cognitive rest. This means that patients should take time away from both exercise or sports and work or school to allow time for their brain to heal. They should refrain from any physical activity until symptoms have completely resolved. Most uncomplicated concussions should have symptom resolution in 1 to 2 weeks following injury. Some patients may experience symptoms that last much longer than this, and may even experience long-term effects such as post-concussion syndrome. Those with post-concussion syndrome may experience an inability to concentrate, decreased processing speeds, dementia, and a decreased quality of life. Prevention of concussions altogether may be an unreasonable goal. Proper equipment, such as helmets and pads, and proper technique in sports is imperative in decreasing the overall number of concussions seen. These may also decrease the severity of symptoms if a concussion does occur. This is one of the newer helmets that is sought to act like a car bumper to absorb more of the impact when a player is hit. Education is a necessity in order for patients to understand the importance of rest. Patients shouldn't return to play until all symptoms have subsided. Understanding alarming symptoms that could indicate a more serious problem is also important. Some of these symptoms are being unable to wake the patient, worst headache of their life, or any acute mental status changes. That concludes my presentation, and these are the references I used throughout the presentation.